Uh, Good afternoon, everyone. Today we are going to discuss about golden hour and its importance in healthcare system. Golden hour. Generally, golden hour term represents to the urgent of need of care for a trauma patient. Means it implies that if we don't do in that golden hour, the morbidity and mortality are affected if care is not instituted within 1 hour. Golden hour is more important. When it comes to the trauma cases, golden hour is 1 hour 60 minutes. When it comes to saving a life of road traffic accident victim, 60 minutes is a golden hour. Rush them to the right trauma hospital within the golden hour to resuscitate and save their lives. When coming to the history, this golden hour term coined by Adam Cowley, the father of traumatic medicine, and he was a founder in Baltimore famous shock trauma institute. In 1975 only, he stated that the first hour after an injury will largely determine a critically injured person and chances of survival. See, why this golden hour is important? Because we see the trimodal death of patient in traumatic patients, where the most of deaths, nearly 57%, will occur at the spot of the accident or the place where the accident is. In next 37% of deaths will occur in first hour after the accidents, and later 20% will occur after 1 to 2 weeks. Mostly the immediate cause or within the second or minutes after an injury, 50% of deaths is due to direct injury to the aorta or heart or brain stem or spinal cord or by acute respiratory distress. These are the common causes that cause the patient's life after an road traffic accident. Then early hours, within an hour, approximately 30% of deaths will occur in first hour, and it's due to hemorrhage. Unless proven, whichever the patient is having a BP less in a road traffic accident, it should be the hemorrhage cause. And after half of these certain will be by CNS injury, like head injury. So these patients can be saved by approximate treatment in golden hour. Nearly 30% of the patients can be saved if they are bought within 1 hour. So it is so important to get the patients in a golden hour. And the late phase, generally it occurs a few days to weeks after the trauma. It is generally due to infection or organ failure. So to prevent the major part of death, nearly 30%, which is an early cause of death in trauma patients, it can be prevented by resuscitating them in a golden hour. That is a main motto of dealing with this golden hour. See, to get this golden hour, it actually starts in a pre-hospital setting itself. The first 10 minutes after the accident, it is known as 10 minutes platinum minutes. And the more 10 minutes, all the medical facility or ambulance or paramedical staff reaching to the point of accident will give us more time to resuscitate in this golden hour into the hospital. Assessment of the victim in the primary survey within 1 minute near the site of accident, and rescue and stabilization within 5 minutes, and immobilize and transport to nearby hospital within 4 minutes. And this is a chart that may made in 10 minutes of platinum minutes. So pre-hospital setting itself is a more important for saving a traumatic patient rather than waiting for a golden and leaving the golden time. What do we do in a primary survey? We'll see his airway, how is taking breaths, is he able to take his breaths, how is his cervical spine, and in any trauma patient, we should not make the patient to move his head to that side, this side. We should, unless it is the cervical spine immobilization is more important than breathing. If he is able to breathe spontaneously, we will let him to breathe. Or if he is in distress, we will assist his ventilation with giving oxygen support or ventilation support. Then circulation to maintain his BP due to his blood loss, we will give fluids or blood. That is a common thing that we do in circulation. And disability, we will see his consciousness level. Generally, it is known as the Glasgow Coma Scale or AVUP scales. Just we use to see how much CNS is intact. Then exposure and environmental. We see any other prevention of any exposure. Not only in trauma, it can be due to burns or anything, and further exposure or any chemical injuries also can happen. We will prevent him for further exposure by removing his clothes or anything. And environmental control should be done. These are the common steps that we do in a primary survey of a road traffic victim patient. This is a pictorial diagram that you can see. This is a way that we should stabilize their neck, unless because the patient will be, if he has a C-spine injury and if we don't address it, he will be talking to us. Suddenly, if we rotate his head to right or left, and the patient may lose conscious because his main respiratory centers were carrying. If it is above C3 level, he can't breathe. So C-spine immobilization is very more important in pre-hospital settings while transportation of patient to the hospital. And based on the volume status or volume, how much of blood loss and what is the impact, generally we have a scoring system or grading systems. If 15% of blood loss is seen, usually his vitals will be heart rate or blood pressure will be normal, and his respiratory will be normal, and his urine output will be normal, and we will do a simple test called ABG. In that we see base excess or base deficit. If it will be usually 0 to 2. If blood loss is greater than 15 to 30%, usually our blood volume will be 4.25 liters. If it is 15 to 30% of the blood volume is low, then the patient heart rate goes high, his blood pressure can be normal, his pulse pressure, the pressure between systolic blood pressure and diastolic blood pressure coming down, and he will have tachypnea. He's having difficulty to breathe, and his urine output start decreasing to 20 to 30 ml. In ABG's base deficit will go high 2 to 6, and patient will be mild anxious. If you touch him, he will be calm, skin and delayed capillary filling. If you touch his nail fingers, and it will be pale. This is a mild shock. And if blood volume is more than 30 to 40%, then his heart rates will be very high. It will be around 120 to 140. His blood pressure start dropping down, and his pulse pressure also goes down. Both systolic and diastolic are decreasing, and his respiratories will be still more high. He will be having difficulty to breathe. His urine output will still more decrease, and base deficits also will increase -6 to -10. The patient will be very anxious, he will be confused, and his peripheries will be cool, clammy, and delayed reperfusion. And class 4 is a severe shock where 40% of the blood is lost or greater than 40%. Is usually his heart rate will be greater than 140, blood pressure is decreased, pulse pressure is decreased, his respiratory rate will be greater than 40, his urine output almost all negligible, his base deficit will be greater than 10, -10. Is obviously with this low pressures, low blood pressures, he will be confused, lethargic, calm, cool, clammy, and delayed reperfusion. And in secondary survey, first the primary survey, we will see airway, breathing, circulation, and disability and exposure. After all this completion of these steps, then we will go for a secondary survey. Secondary survey, we will take the complete history, like patient is using what medication or pre-existing diseases, he has a cardiac problem or any other diseases, or then we will go have a complete head to toe examination. In detail, we'll go and we'll reassess the vitals. In a meanwhile, while we are surveying him, we will be concurrently administrating this IV fluids or whatever investigations which he want, and fluid resuscitation to maintain his BP. We'll be doing it, and complete neurological examination to see whether his spine has got injured or his brain has got injured. We will see, and then we will go for any specific procedures or specific lab investigations that we do after the secondary survey. This all should be done in golden hour. It hardly will take a primary survey to complete in 4 to 5 minutes, and in this history we will take another 4 to 5 minutes. Within 10 minutes, we'll complete his primary survey and secondary survey in a good hospital settings. The complete history, like we'll take as allergic or previous medication or past illness, any pregnancy or last meal and event, how it happens, and we will see, because blunt traumas are most common in automobile collisions where the patient will be normal, but internally he may having the injuries, and in penetrating injuries, firearm injuries and thermal injuries. This all the type of injury is also more important to outcome of the patient will be decided. And specific investigations and procedures, like after taking the complete history and examination, for suspicion of cervical spine injury, just will taken a X-ray in lateral view, like occiput from occiput to T1, and we'll see the anterior posterior view of spine, and we'll get additional X-ray of extremities, any fractures in long bones like femur or tibia in upper bones. If we are suspecting any head injury, a drop in his Glasgow Coma Scale or AUP, then we will do a CT scan to see if any bleed in brain, and if any endoscopy. All these are the specific thing which we do in a later stages once the patient is stabilized. See, definitive care, it is more important to triage the patient in golden hour. See, according to his clinical status and other data of the patient, based on his comorbidities or his vitals, then we will decide whether the patient should be shifted to ICU or emergency OT. If patient come with any blunt injuries, he's having any perforation or penetrated injuries into the stomach, directly we will take him to OTs. If it is having a blunt injury to spleen or to liver, which is greater than grade 3 or 4, then usually we will directly take them to the surgical team will come and take to operation theaters to save his life. Then the tertiary care is defined as a defined patient for evaluation of defined what are the problems here. Then the patient will be after initial resection and operation, and the operation will be the limb saving or life saving. It is not a hemostatic. Just to secure his hemostasis, the surgery will be done. It is not a corrective surgery. To save the life only, we will be doing surgeries. Then usually if it is complex traumas, initial settings, first to resuscitate his life, we will do the surgery. Then later reconstructive surgeries will be done once the patient got stabilized. Not only in trauma, basically this golden hour was, the concept of golden hour was introduced to save life of a trauma patients. But we have other diseases also which can be used as a golden hour, which the common people will usually miss this, and they don't think that we can wait, or we can they waste a lot of time after they get symptoms. Such one thing is that is known as a heart attack and stroke. These two also have a golden hour. How? See, these are the common symptoms after you feel any pain or chest discomfort or lightheadedness or nausea, vomiting, or jaw or neck pain to back, or discomfort of the pain and pain radiating to your shoulder and shortness of breath. These are the common typical symptoms of the heart disease. If you are expecting of all this feeling, then you call to the emergency number which are available in India. It is 108 in our state. Because the golden hour here also lies, it is a 60 minutes, because the time is equal to muscle. The more you waste your time, the more heart muscle get damaged. The same thing. The patient can come in within 5 minutes after his symptoms, within 1 to another 10 minutes to take his transportation to medical unit, and there within 30 minutes he will be evaluated by taking ECG, whether which type of MI, which can be thrombolized or direct want to take cath lab. If it is a cath lab equipped setup, then directly the patient can be transported to cath lab. Usually it will be occurred, it can be done within 90 minutes of your arrival to the hospital. The total ischemic time will be within 120 minutes. The patient can be get reperfused and his heart muscle can be saved, because the time, if the time duration is more, your heart muscle will be damaged more. So after we perfuse also, the damaged muscle cannot restore to the normal level. So the time golden hour applies to this cardiac patients also. So first thing, whenever after you get a symptom, the early and the right hospital where the facilities are available, and reaching to the hospital within a shortest time is more important. Okay. And for stroke also, it is very easy to identify. Just be fast, getting imbalance. You are able not to stand if your head is rotating or anything. If you're feeling dizzy or loss of balance, or any loss of vision, or any facial palsy, like one side face is dropping or your voice is not coming normal, or any weakness in arms or drooping of arms or difficulty in speech. So if any of these symptoms, if you see, you don't waste time, you can call to the nearest hospital helpline. And if you reach to the hospital in time, in this thrombolyze also we have a golden opportunities, it is also time bound. The last symptom or last normal is more important. If you are able to reach hospital as soon as possible in less than 1 hour, then we can get evaluated for initial stroke. We'll see all the history and the degree of stroke or how much affected it is. Then we will take in a CT scan within less than 25 minutes, and less than 45 minutes it can be reported, can be done, and we'll start an thrombolytic agents which can completely, almost all, it can reverse your disease if it is mild to moderate strokes based on the type of infarct and region of infarct. This can be done or tried only if you are able to reach to the hospital in less than window period. The maximum time that we have is 3.5 hours to get this thrombolytic agent. Once it is a mild stroke which can be reversed, if you present after this golden period also, we can't give you, and the patient will have the permanent what to say is defects throughout the life, and he may be dependent on the others. So the quality of life can be given if the patient ideally reaches to the hospital in less than 60 minutes, so he can be thrombolized. See, the golden hour, that is the more important time nowadays. Both central and state governments also taken initiative for traumatic patients to maintain this 10 minutes platinum time to reach all the medical paramedical ambulances to the accident spot, and to take the nearest hospitals, so that the major portion of the patient, nearly, if you see in this trimodal thing, nearly 30% of the patient. It is a very huge number because all accidents usually occur in a very young age group of nearly 20 to 45 of age group. It can be prevented. Nearly all early deaths can be prevented if they are being transported to a good and right center. They can be saved by and we can save the patients from losing their life, and losing a patient with such a young age without any comorbidities, it is a very hard thing. So it is more important whenever you see a situation having a road traffic accident, getting the patient to the right place in a right time is more important than wasting time or moving to the other city or anything or another far place. Yeah. The time is more important because once the patient will go into the irreversible shock, because all this hemorrhagic shock means his blood pressure all going down. If it can be in a once the patient goes into irreversible shock, then it is very difficult to bring him back. So the early is more important. The same way in MI patients, like in heart diseases where heart attacks, here also time is equivalent to your time of onset of symptoms, and the muscle damage will be directly proportional. The more the delay you come after the late presentation, and the prognosis or becoming better will be very less. And the stroke also the same thing. If you present after the window period after 3.4 hours, we don't have an option to thrombolize. If you have a in some cases we can do thrombolectomy where major vessels like internal carotid artery or main branch of middle cerebral artery or posterior circulation in the major vessels only. In that scenarios we can do thrombolectomy, that it can be extended up to 16 hours also. But always just remember, the lesser time and the lesser duration, the more effective chances of recovery. Okay. It doesn't mean we have time for 16 hours, we can wait for 16 hours, then come. No. The onset of symptoms, and as soon as possible, if you reach to the hospital and it can be diagnosed as soon as possible, then the recovery chances will be high from this life threatening diseases, and which leads to poor quality of life. So, golden hour is more important. That And regarding this golden hour, and to conclude this golden hour, the major thing that what the rule of 3 hours: right time, right place, and right treatment. These three are major important to save the patient life in such life-threatening and traumatic conditions where it leads to life-threatening situation and life-threatening like diseases like heart attacks and strokes. It can be the nature of disease or the mortality or morbidity can bring down to the major extent if the patient reach in a right time uh, in a golden hour. Okay. Any doubts we can get. Thank you.